Welcome everyone to today's webinar on the health of Minnesota's childcare sector. My name is Ben Horowitz. I work in the Community Development and Engagement Division here at the Federal Reserve Bank of Minneapolis. Before I go any further, I want to note that my views here today are my own and do not necessarily reflect those of the Federal Reserve Bank of Minneapolis or the Federal Reserve System. Researchers at the Minneapolis Fed have been producing work on early childhood development for almost 2 decades. Fed economists found that investments in high-quality early childhood education for families with low incomes improved those families' long-term well-being and also produced high financial returns for the public. More recently, we have published articles about the interplay between teacher turnover and wages, maternal labor force participation rates, and the cost drivers of quality in childcare. This work reflects the continued presence of early childhood development and feedback we get from business and community leaders when we talk about how their local economies are doing. Today, I'm delighted to be joined by Suzanne at First Children's Finance. First Children's Finance is a community development financial institution focused on the childcare sector. They work with providers and communities to bring important financial resources and expertise in support of the supply of quality childcare. Suzanne is First Children's Finance's Minnesota Director. Suzanne will be talking about our second annual joint survey of Minnesota's childcare providers. There's a lot of great data in the results that we've found, and we're not going to have a chance to get to them all today, but I encourage you all to drop any questions you have in the chat, and we'll try to get to them with some Q&A time at the end. And I also encourage you to keep an eye on both of our organizations' website, where we plan to publish deeper dives into the results. So before I turn the screen over to Suzanne, I'll tell you a little bit about the survey respondents. Today's presentation focuses on the 2 largest categories of licensed childcare providers in the state: family childcare providers and childcare centers. Family childcare providers typically operate out of a home, and depending on their license type, may serve up to 14 children. Most serve fewer and operate without employees. Childcare centers can be much larger. Their capacity is limited by the physical space they operate out of, but also by ratios of adults to children within that space. Those ratios are determined by the age of the children in the classroom. For example, a childcare center must have at least 1 staff person for 4 infants. In the state, about 3/4 of licensed providers operate on a family license. In our sample, which includes a little over 1,000 childcare operators, that number was closer to 80%. The geographic distribution of both center and family respondents within the state also tracked the geographic distribution of licensees within the state pretty well, comparing the survey sample to what we see in the licensing data. One significant difference between the sample and the sector was that about 35% of our respondents reported owning their businesses for 25 years or more, while the share of childcare licenses that have been open for that long is closer to about 20%. So these aren't apples to apples data points, but it's a good indication that our sample might lean a little bit more towards more experienced operators in the field. So with that context in mind, I will now turn the screen and mic over to Suzanne.
Thank you, Ben. All right, I'm going to do just a quick overview of and recap of what Ben had talked about just now. When we conducted this survey last year to ask childcare providers how they had fared after a year of pandemic conditions, I don't think any of us thought that we'd be doing the same survey to mark a second year impacted by COVID-19. But here we are, and we are very happy about the number of childcare providers who took the time to respond to this survey. As Ben just mentioned, more than 1,000 providers responded to the survey, or roughly 13% of all licensed childcare providers in Minnesota. Ben mentioned how our survey compares with the overall breakdown of provider type and geographic distribution. On the left is a bit more detail about who responded to our survey. And yes, our respondents skewed a bit higher among family providers. 17% of our responses were from childcare centers, and the other 4% are made up of Head Start programs, preschools, etc. Our regional breakdown is relatively consistent, with some oversampling from Central and Southeast Minnesota. Finally, of those providers who chose to report their racial and ethnic identity, 6% identified as racial and ethnic minorities and 94% as non-Hispanic or white. There is no specific data in Minnesota about the demographic diversity of childcare business leadership, but this breakdown from the information we do have is pretty close to actuals. And one thing to keep in mind is that our survey went to childcare business leadership, individual family childcare businesses, or center directors or owners. The broader childcare workforce, which would also include classroom teachers and teachers' aides, would be a more diverse group. So those are our respondents. Let's see what we found out. When we conducted this survey last year, we found that enrollment had decreased substantially during the first year of the pandemic, with 50 to 60% of childcare providers reporting decreased enrollment. And while this might be an obvious point to make, in childcare, enrollment equals revenue. So decreases in enrollment went directly to the bottom line of these businesses. This year, we were wondering if we'd see some stabilization, and yes, we have. We asked providers specifically to consider their enrollment between April 2021 and April 2022. Looking at family providers on the left, there's still a significant amount of providers who report large or slight decreases, though the most popular answer from family providers was to report stable enrollment. Very few family providers report increased enrollment. The majority of centers, on the other hand, report either stable or slight to large increases in enrollment, which is a good step in the right direction. However, large and slight decreases are still reported. One thing to note, though, is because we asked specifically about a one-year period, an answer of stable could well mean stability at the already decreased year one pandemic level. And for those of you familiar with the childcare sector, in pre-pandemic times, we already had a huge gap in the supply of available childcare. So while stabilization is a good sign, it only brings us back to our pre-existing crisis. Looking at enrollment regionally, again, keep in mind that last year, between 50 and 60% of providers in every region of the state reported decreased enrollment. We see some consistency across regions, with most popular response being either stable or slight decrease. And you can see that the metro on the left here has a higher number of providers still reporting large decreases. This could mean a larger segment of the workforce in the metro area is still working from home and potentially foregoing childcare. At this point, I want to take a minute to talk about some of the financial assistance programs in place for childcare in Minnesota. Because while it's true that enrollment equals revenue, it's also true that the state of Minnesota has been ahead of the curve nationally in providing direct financial support to childcare providers during the pandemic to beef up that revenue. And we see that play out in some of our data. We asked providers what, if any, public or philanthropic assistance they might have received over the past year. You can see here that of our survey respondents, the vast majority reported receiving childcare stabilization base grants, which have been in place since last summer and come out of funds from the American Rescue Plan Act, or ARPA. The program is due to end in June 2023. I should add that our survey does skew high in providers that report receiving stabilization grants, that 87% of family providers and 97% of centers doesn't align with the statewide percentage. We think that providers self-selected into the survey, so it could just be that those who chose to respond are more likely to be involved with and respond to other statewide efforts. I'm sure many of you, like us, have heard that childcare centers, like many businesses, have had difficulty hiring qualified staff. We're showing the 2022 responses next to the 2021 responses to the question of how easy or difficult has it been to find qualified employees. While most providers last year found it difficult, this year, 73% of centers chose very difficult, and a further 19% chose difficult. And that certainly aligns with what we hear every day. Last year, when we presented this data, I pointed out the fact that no one had answered easy. This year, we actually did get a very small number of easy or very easy responses. Our guess is that these might be some of the few childcare programs that are able to offer benefits or higher wages. And of course, some of the available state grants I mentioned were designed to beef up compensation. Getting to the question of compensation, we asked childcare centers if they'd raise wages or benefits in order to attract or retain employees, and about 80% of them reported yes. The more interesting and concerning piece of information, though, on the right-hand column here is the question of whether providers can sustain any of these wage increases. 30% said they already know that no, they can't, and 60% said they're unsure. There is real concern within the early care and education community about what the sector might look like when the Child Care Stabilization Grant Program ends next year. When a childcare center doesn't have enough staff, they cannot operate at their licensed capacity. So these difficulties in hiring or retaining staff have a real tangible impact on the availability of childcare for Minnesota families. We asked center directors about this, and 53% of them reported that their enrollment capacity has been limited by these staffing woes. We also asked them how many of their childcare slots were currently unavailable, specifically due to lack of staff. We mentioned earlier that we had more than 1,000 providers respond to this survey. Nearly 200 of those were childcare center directors. And of those nearly 200 centers, they reported almost 500 open teaching positions. And those 500 open teaching positions in turn led to more than 1,700 childcare slots that cannot be filled. Just a reminder that this survey and this question specifically is only a sample of Minnesota childcare centers. So we can predict that the statewide number of childcare slots that are unavailable due to lack of staff is quite large. The chart here also shows how these open slots reported in the survey are distributed across the state, the majority located in greater Minnesota communities. So far, we've seen that enrollment hasn't fully recovered, and difficulty retaining and hiring staff is keeping centers from operating capacity. This means that they are facing lower revenues. On the flip side, operating costs have also risen so that childcare providers are really feeling a financial squeeze trying to make everything work. We asked about increased costs, and nearly all childcare centers report moderate or significant increases in the cost of food and supplies. 59% of centers report a significant increase in the cost of food, which isn't surprising as we're all experiencing, but it is striking. You'll also see that there is a significant amount of lost revenue due to employee absences. We asked the same question of family childcare providers and found even higher reports of increased costs for food and supplies. Family providers are less likely to want to or even have the option to buy in bulk, and costs are higher in many rural areas as well. Family providers were also more likely than centers to report increased transportation, maintenance, and utilities costs. Of note on the topic of operating costs, many survey respondents noted that existing subsidies for food have not increased to keep pace with inflation. Like most small business owners, childcare business owners often find that the financial health of their businesses is entwined with their personal finances. We asked all providers whether their household income was impacted by financial losses in their childcare businesses. Most of them said yes. 70% of family childcare centers answered affirmatively, and nearly 40% of childcare center owners did as well. In the next slide, we'll see that much fewer family providers raise tuition rates as compared to centers, which isn't too much of a surprise given the different business models and relationships with parents and families. But with centers, we do see some level of reluctance to raising tuition rates. I find it interesting that these answers are so strikingly consistent between the first and second years of the pandemic. We do see some improvement from BIPOC providers, but only some, and the rest of the responses are nearly identical to last year. We wanted to get a better idea of cash flow within these businesses, and here are some of the responses with comparisons to last year's survey. This year, we added a question about whether providers sometimes skipped paying themselves. We heard that a lot anecdotally. And a fair number of both family and center providers did just that. What we know from working with childcare providers is that they will often pay their bills before they pay themselves. So this information isn't all that surprising to us. You can see that while centers in both years reported more often that they'd raised tuition, there is a real jump in this year's survey, that big green bar there, reflecting that financial squeeze I mentioned a while back, trying to deal with both increased costs on the one hand and reduced revenue on the other. We were pleased to see this year that far fewer childcare providers accessed high interest financing. We defined high interest financing as using credit cards or payday loans. but it is still an option for some, as you've seen. And we still have noticeable rates of providers tapping into their emergency funds. Given that there is still financial uncertainty in the childcare sector, we asked providers how long they thought they can stay in business. Strikingly similar responses across the state, with a consistent 20% of providers saying they've probably got less than 1 year, and a further 50 to 60 not sure at all how long they can stay in business. That's a concerning level of insecurity across the sector. The childcare sector for years has been losing family childcare providers in particular, with not nearly enough new providers starting up to replace that capacity. In this survey, we asked some pretty specific questions, but we also asked some open-ended questions of childcare providers. One of those questions was, what would help keep your business financially viable? With more than 1,000 respondents who answered this question, one of Ben's colleagues at the Minneapolis Federal Reserve created this word cloud to demonstrate the most popular responses. The most popular words in these responses turned out to be food, grants, and help, which I found particularly interesting and a little bit concerning. You'll see that increase and pay are right up there as well. Finally, we also asked providers what actions they've taken in the past year to reduce costs or increase their revenue. Here are some representative answers. Because of my husband's income, we are making ends meet. Currently, we are okay due to monthly grants coming in. They are a huge help for sure. Using my savings. I've lost out greatly on income due to rising food prices. I wish I could raise rates, but parents will pull their kids from care to pay their own bills. I believe I will need to raise my rates, which I really don't want to do. I closed my infant classroom to stabilize costs and staffing. Running with bare minimum staff, and I took a second job. Our county gave out a grant. And finally, continue to work and try and stay open. That last comment, continue to work and try and stay open, really reflects what we see every day working with childcare providers. They know how important their role is, not only for the families they serve and the children they care for, but that they are a foundational and critical component of our state's economy. And while year 2 of the pandemic does look a bit better than year 1, their responses to the survey show a high level of concern and instability in the moment. Here's some information, contact information, if any of you are interested in connecting with us, either online or by email. And I'm gonna pass it back over to Ben.
Suzanne, thank you for walking us through all of that information. And I'll just reiterate from the beginning first, if you have any questions on what you just saw, feel free to drop those in the chat. And both of our organizations will be continuing to work with the source data, including the open-ended comments that came in at the end. There's a lot still to explore, and we look forward to sharing that with all of you. So I'll open with a question I have for you as somebody who has been working in the sector. Was there anything in the data that kind of grabbed your attention as something that might have been surprising? You mentioned where some of the results lined up with what you've been hearing, but were there any that took you a little bit more by surprise?
I'm not sure I would qualify this as a surprise because, you know, we all live here and we all see our own living costs go up. But when you think about food in a childcare and how difficult it is to afford groceries and food, just putting that in the context of providers who are caring for children is really concerning. And there were just a lot of comments about choices that providers were making. I'm cutting back on toys. I'm cutting back on curriculum. I'm cutting back on activities in order to afford food. That was tough.
Thanks. And you described, I think, very well the financial choices that childcare providers might have to make in order to keep their business operational. Why do you think people do wind up pursuing higher interest financing, even though, as you mentioned, the rates have gone down. What leads people into that avenue as opposed to any of the others that are available out there?
In a lot of cases, there may not be any other available choices. We work with a lot of low-income providers, providers of color. Many women in particular come into the childcare business without a full business ownership background. Maybe their credit isn't so great. They don't bring a lot of collateral into it. They're really just trying to keep the doors open. And I said this last year when we did this survey, I'll say it again. Governor Walz directly asked childcare providers to stay open during the pandemic, and providers took that seriously. They wanted to help, they wanted to contribute, they wanted to be part of the solution. And so we just see people are going to do whatever they can to keep their business open with the faith that it's going to get better at some point.
Thanks. And I'm not seeing any other questions in the chat. Oh, we have a question about the open position data being open. So we're getting some questions about how the challenges for providers might have impacted families with lower incomes who are trying to access childcare, who might be using state subsidy programs like the Early Learning Scholarships or the Child Care Assistance Program. Was there anything in the data that might be illuminating on that end?
Well, the one comment that we saw is that subsidy rates are not keeping up with inflation. And again, this we didn't survey families in this. This just went to providers, and so they're speaking about the options that they have and what they can call on.
How about the difference in the family providers and the child care centers? I think one of the more striking differences might have been in the rates at which the different settings, how likely providers were to report that they had increased tuition. Is there something about the relative models there that might have led to that, or how might we interpret that?
Sure. I want to be careful and say that, that when centers raise their rates, it doesn't mean they're bad, for doing that. This is what they should be doing. This is, you need to stay open. Family providers often have, first of all, they've got fewer families in their programs. So maybe they're only serving 3 or 4 families with, 8 to 10 kids total. And they have really personal relationships. There were a couple of comments at the end about providers saying, I know the minute I raise my rates, they're just going to pull their kids. So they're trying to do what they can to both meet the needs of the families who they know are going to have a hard time paying more, but also keep those kids in their business.
Great, and there's a question in the chat about whether we can break down the open position data by region or county, and I'll just say the short answer is yes, and it's probably something that will be included again in the deeper dives that we'll put out later on. But maybe a closing question here. We did see some breakdowns between Greater Minnesota and the various regions that Greater Minnesota contains and the 7-county metro. At a high level, do you have any thoughts on what the data might suggest we pay attention to and differences between those different markets, recognizing,
Sure.
Of course, that there's variation within all of those regions themselves?
Sure. One thing that we've been watching for a long time is the viability of childcare centers in Greater Minnesota. It's just much harder to right size a center in a rural area that doesn't have as much of either a labor market or potential families to draw upon. So that's one thing that we're a bit concerned about. We're also really watching the decline in number of family providers, and that's I think is going to be a longer term both demographic but also economic issue that we're going to have to deal with.
Thank you for that, and thank you again for sharing your expertise with us here today. And with that, I'll offer one final reminder to keep an eye on First Children's Finance and the Minneapolis Fed's website for both the slides here today and a recording of this webinar if you'd like to share it, and greater detail on the survey results, and more generally, future regional economic condition webinars that cover a wide range of topics, and also future community development engagement webinars, which also cover a wide range of topics, but certainly childcare and early childhood development are frequent topics of interest for both. So with that, thank you very much for your attention and have a great day.
Thank you.